which of the following is the most likely cause of the patient's symptoms? 65-year-old woman, history poorly controlled, diabetes, presents on sudden onset double vision, difficulty moving her right eye. On examination, her right eye is deviated laterally and down, so it's down and out. Unable to move it medial or upward. Okay. Her right pupil is dilated, and the pupillary light reflex is absent. Okay, I know we've talked about this a little bit. How do we get a palsy? How do we get a palsy here? I know cranial nerve 3, I'm pretty sure does the like pupillary light reflex. Trying to remember 4 and 6 exactly where they are. Okay, abducens is gonna AB duct, so that's gonna move, unable to move medial, but I don't think that really does too much upward stuff. Damage to MLF, that's more of like a MS problem. I usually think about that. Poorly controlled diabetes is probably something with like a blockage here. It's the compression of cranial nerve 3 by an aneurysm. I would think more ischemic than a straight palsy. It doesn't really fit a straight palsy.
Okay.
So I would go with A, ischemia of CN3.
Yeah, so this is kind of knowing your nerve palsies, right?
Okay.
So let's talk about this. Okay, cranial nerve 3 will do the majority of your ocular motor, except
Yes.
which two muscles?
It doesn't do the abducens, right? So it doesn't. I know that's cranial nerve 6, and then I know 4 is it trochanter? Is that the right or
Trochlear. Yeah.
trochlear? Oh, I
4
thought
is
I said
trochlear,
trochanter.
6 is abducens, right? So
Yes.
trochlear is the one that deals with your superior oblique, which, it's kind of a lever, so it kind of pulls it, I believe, down and laterally, right? And then
Yep.
your abducens is your lateral, right? So your 3 does everything else, right? So
Mm-hmm.
what ends up happening is the only ones that kind of work are your superior oblique, which will help pull your eye down, right? And
Mm-hmm.
then your 6 still works, right? So that's why they always say when your cranial nerve 3 is out, your eye is down and out, right? Because the other muscles,
Oh, okay.
right?
Okay.
So 6 and 4, right? Cranial nerve 6 and
Okay.
4, right? And then on top of that, the reason why the pupil is dilated, right? Because your cranial nerve 3, it what is it called? It is your parasympathetics for your eyes.
Okay.
Okay. So if your
Okay.
parasympathetics don't work, then your eyes will be dilated.
Okay.
Right. And the way I remember
That makes
is,
sense.
yeah, the way I remember which one does which, right? Like you always wonder, okay, so sympathetics would, some people get confused. Do sympathetics dilate or do parasympathetics dilate? The way I remember is when you're running from a bear, you want more
You want
light.
like tunnel vision, right?
Yeah. Well, I was not going to say
Oh,
like,
you want more light. Oh, okay.
yeah,
Okay.
yeah, you get what I'm saying. So
Okay.
you wanna be able
Yes.
to evaluate the environment more. So you want more light in. So obviously more light means your pupils dilated,
Dilate.
right? So
Oh, okay.
yeah. But yeah, so best one here, right, with the dilation and you can't constrict, right? And your eye is down and out. So that's cranial nerve 3.
Wait, so
But yeah,
cranial nerve
so
3 is sympathetic dilated,
say it
right?
again.
Because your cranial nerve 3 is sympathetic because you want it to be dilated, right? Because it's the
So
sympathetic
so
response, or do I have it
cranial
backwards?
nerve 3 carries the parasympathetics.
Okay.
You understand what I'm saying? So, like the
Yes.
parasympathetics constrict the eye, the
Yes. Gotcha.
sympathetics dilate it. So, if you
Makes
mess
sense.
up 3, then the only thing that works is your sympathetics, which is it will keep it dilated.
Gotcha. Gotcha.
Okay.
Makes more sense.
All right. Yeah. The rest, you kind of went through already. We went through 4 and 6, right?
Hmm.
Trochlear and then obducens. So,
And then it's not going to be an aneurysm, right? Because they have poorly controlled diabetes, double vision. So it's not going to be an aneurysm with that.
let's see. Poorly controlled diabetes. Yeah, more likely going to be ischemia because of the
Okay.
diabetes. right?
Okay.
But if, high blood pressure and things like that, or, history of polycystic kidney disease, right, then E is going to be a better answer.
Okay.